Hi, I'm Yevgeniy Yuzefpolskiy, and I work in Dr. Estelle Bettelli's lab, where we focus our research on multiple sclerosis. The novel SARS-CoV-2 Pfizer and Moderna vaccines have significantly decreased the severity and hospitalization rates of those vaccinated in the general population. Our study focuses on understanding if people who are immunocompromised are offered the same protection following vaccination. Multiple sclerosis patients are treated with immunosuppressive drug therapies to reduce the autoimmunity, which targets their central nervous system. These disease-modifying therapies limit the symptoms of MS by suppressing the immune system in ways that could impact vaccine effectiveness. Our data looks at early implementation of the SARS-CoV-2 vaccines in MS individuals treated with one of three disease-modifying therapies and compared their immune systems to those of immunocompetent controls. In our study, we determined that all three disease-modifying therapies decreased at least some aspect of the vaccine's cellular or humoral responses. Humoral immunity is necessary for generating antibodies to neutralize the spike proteins of SARS-CoV-2. Cellular immunity is comprised of cytotoxic memory cells, which help clear infected cells, and T helper cells whose differentiation can impact COVID-19 protection. Now, in anti-CD20 treated MS patients, we observed that the majority of B cells are eliminated, and we did not detect significant levels of spike-specific antibodies. These patients showed no defect in COVID-specific T-cell expansion, however. Dimethyl fumarate treatment, which aims to decrease the activation of T-cells, caused only a slight decrease in antibody responses that normalized by 3 months post-immunization. However, these patients, we found a significant decrease in the expansion of vaccine-specific CD8 T-cells. Both anti-CD20 and DMF treatments altered the differentiation of the T-cells, which could affect their protective functions. Finally, fingolimod treatment, which works by blocking migration of T-cells, had the strongest impact on vaccine immunity, as we did not detect any humoral or cellular immune responses in fingolimod-treated patients. We believe our findings, together with other recently published data analyzing similar cohorts of MS patients, could be used to better understand the mechanisms which are important in forming long-lasting immunity following vaccination. Future studies will be necessary to determine if the detected immunity generated by COVID vaccines in MS patients is sufficient to mediate protection, or if different vaccine designs are necessary to help those treated with immunosuppressive therapies. We hope altogether these data can inform future vaccine efforts and strategies to make sure that everyone can get the optimum protective effects of vaccines.